Tracks on a gorgeous Monday at 11:15 a.m. Today, I have a very special guest in the studio with me. Now, we are speaking to a pharmacist, Mr. Jeffrey Tang Hang Chong. Now, we're talking about missed doses and effects on TB treatment. We're currently live on Facebook at Tracks FM Official. So if you want to say hello, feel free to do that. And, definitely ask some questions, any questions that you need to Jeffrey, because we're always open to that. But it is a very fascinating conversation simply because when we thought, oh, you know what, TB is like a thing of the past. Apparently not. It definitely is very much in existence, and it's something that we definitely need to be aware about. So let me welcome Jeffrey. Thank you so much for joining us in the studio.
Morning. Thank you.
Yes, not a problem at all. No. Okay, so I suppose this is something that a lot of your patients would ask you in your clinic. But first and foremost, let's talk about your experience with dealing with TB in your clinic.
So hi, morning everyone. So I'm a pharmacist in the clinics. So day in, day out, we see a lot of patients with different disease. So TB is not a new thing. And we do encounter TB patient that came in a family, whole family, maybe 5 or 7 of them. And the mother, the dad are coughing. And the kids has no symptoms, but they will get treated as well. So this is how bad it is and how contagious it is. And speaking about TB, a lot of people forget about TB when we are dealing with COVID because TB actually have been existed for a long time, and we really need to do something about it and not just talking about COVID all day.
Yeah, definitely. Well, I guess for the benefit of our listeners, to refresh everyone's minds again, what exactly is tuberculosis? And let's talk about the current status of this disease in our country as well.
Yeah, sure. So tuberculosis, or we call it as TB, is actually very contagious. It's a contagious disease that's caused by the bacteria, Mycobacteria tuberculosis. So it's bacteria, it's not a virus. There's a difference. So COVID is virus, but TB is actually a bacteria. So it can spread through the air by water droplets. So let's say if now I sneeze, let's say I have TB right now, I cough or I sneeze, and you inhale the water droplet in the air, and you probably will most likely get it.
Okay, very contagious.
Yes, very contagious. So TB can affect a variety of organs. So, but mainly, most likely is the lungs. Yeah. So if it happens to infect the lungs, we call it as a pulmonary TB. So I would say the lungs is the most common site of TB infection, but TB is very sneaky as well. It can affect other organs, example like our joints, our glands, or even our brains. Yeah.
Wow.
So this is how sneaky the bacteria is, but most commonly it's lungs. I would say.
Okay. And the current status of this disease in our country, like, are there a lot of people who have TB in Malaysia?
So according to my data, I'm not sure it's the latest or not. It's 2019. I get it online. So it's 92 per 100,000 population. So like what I say, maybe in my clinics we'll get 1 or 2 new cases in every 2 weeks. Yeah, if you are lucky. If we got a bad day, probably like 5 patients.
Wow.
They came in once because it's a family thing.
Right.
Yeah, if your father gets it, it will spread to the child, even the babies. Yeah, that's how bad it is.
Okay, all right. So what are the signs and symptoms of TB?
So the sign and symptom of TB is first of prolonged coughing. So let's say if you have cough for maybe not 1 or 2 days, we are talking about 2 weeks. Or one of my patients I know he has been coughing for I think around 6 months.
Wow.
Yeah.
And he did not do anything about it.
He didn't do anything about it. He just thought it's a normal cough and maybe just dry throats. Yeah.
Okay. Because it's just the throat, but then it doesn't feel like there's anything.
Yeah. The patient probably will get very tired or they'll feel fatigue and loss of appetite. And when you lost appetite, you're not eating anything. Definitely weight loss. Yeah. Or maybe sweating at night. Yeah. And also probably fever and pain in the chest. Yeah.
Okay.
Because it will make you cough so much until like, wow, it's
quite painful
painful in
after
the
a
chest.
while.
Yeah.
But there are the mildness and the severity.
Yeah. The most severe one would be, I think the most common one would be coughing with phlegm.
Right.
Or if more severe one would be cough out blood.
Right. Okay,
Yeah.
then hopefully one must not wait when it comes to this situation.
Yes.
What kind of detection inspection can be, performed?
Talking about TB screening, right? Our government has done a lot of effort in TB screening. So, firstly, is that the government has done screening in high risk group, for example, like HIV patient or diabetic patient, or even the inmates in the prison or any detention facilities. So, after we screen them, and then we can give them treatment. So, the screening will be what we call the tuberculin test. Is a very easy procedure to perform. They just inject the tuberculin, the medicine, under your skin, and then they will observe for maybe 3 to 4 days like that.
Okay.
Yeah. Apart from that, chest X-ray. So if they see any changes in your chest, yeah, and not to forget, the last one will be the sputum examination. Means you have been coughing, you've been producing a lot of phlegm. So the nurse will ask you to cough and collect your sputum, and then we'll send it to the lab, and then we will grow the sputum to see anything came out. Yeah.
Well, Jeffrey, if I were, say, for example, I started having a cough, for example.
Yeah.
When should I think to go get tested for do a TB screening? Because is it like, because I mean,
Yeah, I
there's so
understand.
many, unfortunately, there's so many viruses, bacteria in
Yeah.
the world where you can't really tell the difference. That at the end of the day, if you feel as though this person has had it for ages and is completely unaware about it, it is quite dangerous for people around them. So what are the telltale signs for them really quickly to just say, like, you know what, I should probably get tested?
Okay, maybe I have to say is that not all cough are TB. And not all cough are TB. And first, you have to think about, did I recently contact with anyone with TB before? Maybe my colleagues, or maybe my friends, my family. Yeah, if they have TB and I started to cough, that's something we need to worry about.
Of course.
Yeah, but if it's just a 2 or 3 day things, means you get recovered after 2 or 3 days, probably it's not a TB. But if you have been coughing for 2 weeks non-stop and you have been producing a lot of phlegm, a lot of sputum, and you are feeling very tired, you feel like it's not normal, it's not like normal cough and flu, yeah, that's something you should go and see a doctor.
Okay, noted on that. Okay, thank you so much. Now, I'm
sure.
speaking to Jeffrey Tang Hang Chong. We're talking about missed doses and effects for TB treatment. Now, when we come back, we're going to take a short break, but when we come back, we're going to talk about how TB disease is being treated. So definitely keep it locked on tight to Trax FM. And I'm speaking to Jeffrey Tang Hang Chong. He's a pharmacist, and we're talking about missed doses and effects on TB treatment. Now, tuberculosis is something that is no joke, and we need to be re-informed, especially because it is something that has existed for a very long time. But I think because of the highlights of COVID, now TB is something what people might think it's a thing of the past. So earlier on, Jeffrey was talking to us about what were the symptoms and the signs of tuberculosis and the different types of inspections and detections that can be performed. But for now, we want to ask Jeffrey, welcome again.
Yeah.
Thank you so much for joining us. How is TB being treated?
So let me talk about the goal of treating a TB patient. So if you have an active TB, first we want to cure you with the TB, of course, and reduce the spread of TB to others, your family, your colleagues, and also to prevent the recurrent TB infection in yourself. Yeah. So active TB will be treated for 6 months. Means you have to take the medication for 6 months. So it's something that we really need to look at, because 6 months is no joke, it's half a year. Yeah. So you'll be include a 2 months intensive course with antibiotics. So 4 types of antibiotics. The first one will be the isoniazid, rifampicin, pyrazinamide, and also ethambutol. And then it follow up with a 4 months extension phase with 2 types of antibiotics. Yeah. So throughout these 6 months, you have to take the medication as instructed by the doctor and also the pharmacist, and you must not miss the medication. Yeah. So for me, it's very important for the patient to comply to their medication, because if you were given with antibiotics, you know that you should complete the whole course, If not, it will result in treatment failure. That's what we don't want to see in our patient.
Okay, so now I've spoken to my like a few people about this before, and we don't really understand the repercussions of not completing your antibiotics.
Yes.
Could you share with us what are the consequences to not following antibiotics or the TB treatment? Well, I mean, the thing is, it's like TB treatment is one thing, but not to complete your antibiotics. What would happen?
Okay, so when you go to a clinic and if you receive antibiotics, the most common one the pharmacist will tell you is finish your antibiotics. Please finish your antibiotics maybe for 5 days or 7 days. And I'm not sure how many of us really, I would say how many of us really comply the whole 5 day or 7 days course. And if TB patient, if they do not comply to the medication, it may cause treatment failure, like I've just mentioned before, and it may also cause multi-drug resistant TB. So when we talk about multi-drug resistant TB is another bigger topic, because this kind of TB, they put in a layman term, is they level up. Yeah, means the normal medication, it can't kill them anymore. The first line medication, we can't kill them anymore, and we need a more advanced medication.
And are these advanced medications available or not
Yeah,
necessarily?
it's available, but it also comes with costs, side effects, and also longer treatment duration, up to 20 months.
Okay, I'm glad you brought up the side effect situation. Now, it's been said that the medicines that's used to treat TB can also cause side effects. How do we deal? I mean, what kind of side effects do you expect, and how do we deal with them?
All right, so the most common one, I would say, nausea and vomiting, and loss in appetite. Yeah, this will be the most common one when you first started with TB medication. And it will gradually improve, I would say. And if you do have this, I would say, side effects, it's very important for you to speak to doctors or pharmacists. Tell them, hey, I have this, I experiencing this, it's not very pleasant, so just help me out. So doctor will give something to you, maybe to help with your nausea or vomiting, and maybe they will change your medication. Yeah. So the most important part is that you do not stop taking the medication.
Yep.
Yeah.
During the 6 months, do you have to be in isolation?
First 1 month, yes.
Okay.
Yeah. So after you have started, and I think the rest you can just like a normal person, because once you have started with the antibiotics, and in a certain point you are not contagious anymore, and you can just roam around like a normal person.
Oh, but obviously you want to wear masks.
Yeah, best to wear a mask.
Okay, so you mentioned that you can at some point when you're not contagious. So I take it this is when you have active TB or inactive TB. Is that the same thing, or is that different?
No, it's a different thing.
Okay, could you tell us what is active TB or inactive TB? You mentioned active TB earlier.
Yeah. So just now we were talking about active TB, and also I think I didn't touch on the topic of inactive TB, or we call it as a latent TB. So let's say you are contact with an active TB person, but then you do not have the symptoms, but the bacteria is inside you.
Right.
Yeah. So this is what we call the inactive TB. So you can just think it like the bacteria is sleeping. They're waiting for a point where they will just
Wake up.
Yeah.
Like,
So there will be a point where your body is very weak. So some people, I would say many people who have inactive TB infection will never develop TB in their whole life. But TB can be active later on if you are really very, very sick or any other reason. So first one, like you have a weak immune system, the bacteria become active. And that's the point where inactive and become active. Yeah.
Interesting. It doesn't matter what,
Yes.
how long, no one really knows what would happen. It just pops out of nowhere.
Yes.
Pop goes the weasel, right? Yeah. But what are the symptoms and treatment for inactive TB? And should I be worried if I actually had it?
So if you have for inactive TB, you don't have any symptoms, but if you know that you have close contact with an active TB person, you should go and get screened. and we will prescribe medication to you, just antibiotics. Yeah. So it will be a 3 months or the 6 months course, depends on the antibiotics. And it does come with unpleasant side effects as well, but it will be very mild. So for just like TB medication, like what I have mentioned just now, nausea, vomiting, and another one will be probably tingling in your fingertips. Yeah, because the medication affect your nerve. But we will give you supplement for that, so no worries about that. We will give vitamins to help with that. And also it will actually affect your urine colors. It will change your urine color to orange or more yellowish or darker type. But it's completely normal. It's nothing wrong with your body. Yeah, these are the things that we have to tell the patient when they started with the antibiotics. Yeah.
Yeah, I think for any patient, when it comes to meeting your doctors or your pharmacist prior to consuming your medication, please ask them if there are any side effects, what to look out for, so that you don't get freaked out too much if something were to happen. I mean, if your urine suddenly turn orange, you're like, surprise! Okay. Yeah. But anyways, all right, we're going to take a really short break. Thanks so much for that, Jeffrey. I'm speaking to Jeffrey Tang Hang Chong. He's a pharmacist, and we're talking about misdoses and effects on TB treatment. We're currently live on Facebook at Trax FM Official. Feel free to say hello, and we'll be right back. Trax Momentum with me, Diana, and I still have Jeffrey Tang Hang Chong, the pharmacist, in the studio with me. We're talking about misdoses and effects on TB treatment. Now, it's been incredibly insightful and something that is quite important for all of us to definitely know more about. Just a quick highlight on what we talked about earlier. In case you missed out the conversation, we were diving into understanding what tuberculosis is, the different types of symptoms and the treatments that are currently available, and the importance of actually really finishing your treatment. So I think we're closing up the conversation very soon, but Jeffrey, I do want to get people to really, really hear your advice in terms of when it comes to even having the remote idea of perhaps I might have TB. Where should I go if they think they have TB?
All right, if you think that you have TB, you should go to a healthcare facilities, of course, whether it's a hospitals or a clinics, but you should seek help. The most important thing is you should seek help. Yeah, so don't feel shy to seek help, and don't feel afraid to speak to doctors about your conditions, because I'm sure they will help you out. If you have prolonged coughing, maybe more than 2 weeks, maybe for a month, that is something unusual. So you should definitely go to the health clinics and speak to the doctors or maybe a pharmacist. So yeah, they will do screening to you. And the screening is not painful. I need to emphasize on this. They will just collect a sputum and maybe a chest X-ray. Yeah.
Just to double check and
yes.
Yes. Don't feel any fear if you are, if you actually think that you might have some of the symptoms. And if you happen to know anyone who does have symptoms like that, definitely just nudge them in the right direction. Now, Jeffrey, unfortunately, we've run out of time. I think I'm going to leave you with a final question for today is what is your advice, and do you have any message you'd like to say to our listeners right now?
Okay. So my final advice will be let your kid take the BCG vaccine. Yes. So the BCG vaccine is completely safe. It will protect your child from the TB disease. And if you do have active TB, seek treatment. And always follow your doctor or pharmacy instruction in taking the TB medication. And take the medication at the right dose and interval time. Take your medication every day. Do not miss the medication. And consult your doctor if you have any side effects after you're taking the medication. So if there's anything you want to ask after this, you can ring up to my colleagues in the National Pharmacy Call Center, NPCC, at 1-800-88-6722. It's available on Monday to Friday from 8 to 5 p.m. except public holidays.
What's the number again? 1-800?
88-6722.
6722. All right. You heard that. Well, that's what Jeffrey's advice is. Anything else? Last call?
TB is treatable. Don't be afraid to seek help. Yeah, that's all.
All right. Thank you so much, Jeffrey, for joining us. And thank you for telling us everything we need to know about TB.
Okay, thank you. Thank you for having me.
Not a problem.